Good evening, everyone. Myself, Dr. Santhosh Pandey. As we have discussed in the last session about how to deal with the teaching station in MRCEM OSCE. Now, in the today's session, we will discuss in detail about how to interpret data in case of you get a station of ECG, ABG, or X-ray, or any blood test discussion. Basically, this is also a part of teaching station, and indefinitely you'll get one station. Either it might be ECG, ABG, or X-ray abnormal in your teaching station once you go inside the station. Okay, to start with. I'll start with the scenario. Mr. John is your junior nurse who has asked you to teach him about an ECG, how to interpret an ECG. Now, your given task is teach him about teach him about your findings of the ECG and explain your management plan and answer any question if he has. Now, this is the segregation of the marks given to you, and this thing will be given once you are outside the station. Now, once you read the station, two things you keep in your mind. Either it is a ECG station or a AB station or a X-ray station. You should think about two important points. Now, what is the main points is that if you follow the general approach, even if you imagine if you don't know about the exact diagnosis of the ABG or you don't know the ECG findings, exact diagnosis, in that case, even if you follow the normal general approach, you can get 8 out of 10 marks. So main important is not about the diagnosis. Your approach should be very good. So they always you follow the general approach, which I have told already in the previous session, which I will repeat in this session also. And on the top about the exact management diagnosis, if you tell you get 9 out of 10 out of 10 also you can get it. It's easy station. Okay. And the next important thing, whenever you get an ECG, ABG or chest X-ray, you think if it is abnormal, in that case, always before you set any learning objective for your junior, make sure you talk about the patient. You always ask whether the patient is in your safe hand, whether someone has taken care of the patient, is he safe, is he comfortable or not. Then only once you are sure about the patient is in safe hand and patient is comfortable, then only you move ahead with the setting learning objectives for your junior. Okay. So we'll start with the station, how to deal with the station. Now this was the ECG ask. Again, if you go inside the station, please ask about the ECG in the initially only. If you don't ask, they will not give you the ECG. Okay. So now what to do? So once you enter the inside, always follow the general approach as I told previously. So what are the sub part of your general approach is your introduction, learning objectives, and general management of the patient and the specific management depending on the ECG findings, and you recap. This is the same thing which I have told previously, but now in terms of ECG teaching, we'll revise the same stations. So coming to the introduction, you will tell always good morning, I'm Dr. Santhosh, an ED registrar, and may I know your name and level please. Once he introduce himself, then you can tell nice to meet you. And I believe you have something to discuss with me regarding an ECG interpretation. Then he will tell yes. Then it's better to ask always how much you know so far about the topic about the ECG. He might tell something he want to know some specific things only. So you have to focus on that specific points only because he might be given some instruction by the examiner. So will utter, I know I need to know about the ECG specific diagnosis. I know about the basics like PQRST, the waves and all. So whatever you don't know, you have to focus on that only. And this helps you to save time also. Okay. Now, learning objectives. Then you have to tell your junior, like, I will set a learning objectives for you today. I'll teach you about the basics of ECG and you will start teaching him about the leads you tell him. You can tell him that they are the 12 leads. Usually we have basic 12 lead ECG, 6 precaudal leads and the 6 chest leads, 6 limb leads and the 6 chest leads. Then you talk about seconds. Then you can tell him that each lead, small lead is about 2.5 seconds and the last limb lead is about 10 seconds. And then talk about the squares. Tell him they are the large squares and the small squares. And every large square has 25 small square. And each small square is about 1 mm or 0.4 seconds. So a big large square is about 0.2 seconds. When talk about the waves, you tell him that the basic ECG is. Whenever you teach them, show him the ECG and tell him about the waves. That this is the P waves, QRS waves, and T waves. You can tell him P stands for atrial depolarization, QRS ventricular depolarization, and then ventricular depolarization. Just show him the ECG and teach him to develop a bit rapport with him. And always, whenever you teach them, make sure you check the understandability, that is understanding. So you can ask him whether you have understood or not. That is also important while teaching a station. And then talk about heart rhythm. This you can tell him, seeing the RR intervals, you can make sure whether the rhythm is regular or irregular. Then once you have seen the rhythm, then you tell him to calculate the rate. This you can tell him how to calculate the rate. You can tell him if the rhythm is normal. In that case, 300 divided by number of the large boxes in between RR interval. Always tell him If even if your the given ECG is abnormal, rhythm is irregular, in that case you can tell him how to calculate the rate is that if you calculate the number of RR interval in 6 seconds multiplied by 10. This is how you calculate the rate if the rhythm is irregular. Then talk about axis. Only for the axis, teach him to see how axis from the lead 1 and the lead 3. Teach him in a very easiest way. Tell him if you see the lead 1 and the lead 3, tell him to see for the R, positive R deflection. Can see if the both are in positive reflection, that is the normal axis. Then you can tell him if the lead 1 is having positive reflection of the R wave, this is left axis deviation. Then you can tell him if you can see only positive R wave deflection in the lead 3, then that is right axis deviation. Or if you see both are having negative reflection, then that is extreme deviation. This is the normal way of teaching the axis. You can show the lead 1 and the lead 3 and teach him axis. Then next about the diagnosis of the ECG. Then the exact ECG, what is the final diagnosis, you tell him to your junior, and then you have to tell the management plan depending on the diagnosis of the ECG. Now this is the important slide. Every ECG station, even if you don't know the ECG diagnosis, just tell him the basic diagnostic management. This you can consider for each and every patient of the ECG stations in your OSCE. Tell him to keep the patient in your recess, connect to the cardiac monitors, and then tell to examine both heart and the lungs, and then do specific blood tests if required, that is the cardiac enzymes, and call cardiologist. This you can consider each and every station of the ECG station, teaching station. And the end specific management you have to discuss depending on the ECG diagnosis. Now the given ECG which I have told, you can see, you can tell him this is looking like a narrow complex tachycardia. Most probably it is supraventricular tachycardia. And then tell him the diagnostic exact management you have to tell him depending on the ECG findings. You can tell him this depends on the stability of the patient, whether the patient is stable or unstable. If the patient is stable, you go ahead with vagal maneuvers and IV adenosine. If the patient is unstable, you can go ahead with cardioversion. Synchronized cardioversion. I can consider the joules also 70 to 120 joules because it is narrow complex regular tachycardia. Understood? Then once you have talked about specific management, tell him to be, as I have told previously, ask straightforward questions also to check the understandability of the whatever you are teaching him, is understanding everything. Once you are confident that he has understood everything, at the end, ask straightforward questions if you have any open-ended questions, because most of the scenarios the examiners will be giving few questions to be asked in the end. That's why if you don't ask him his questions, he will not utter your question. So better to ask if he has any doubts at the end of the station. If he tells he is not, if you clear all his doubts, then you ask him, I will provide you data, website and videos which will help you to learn more, and you can come back to me anytime whenever you have any doubt. And then still if you have time, then tell him to summarize the entire thing which you have taught. But most of the cases you will not have time till you reach the station. Important thing is that, which I have told previously also, don't waste time. Don't get into detailed teaching of the ECG. Don't show your knowledge. This is not a knowledge showing station. So stick to your time, stick to the specific perform which I have told. You can get optimate time because you have to spend some time in the clinical reasoning also. Because if you see the scoring, it was 20 marks was there on the clinical reasoning. So out of 8 minutes, you have to spend near about 1.5 to 2 minutes for the clinical reasoning and the questions which we have the actor has. So it's very important to stick to your time. And this implies to each and every OSCE stations. Okay. Thank you. So we'll come to our next station. It was ABG teaching station. So he's a junior who have been asked to explain about the ECG, which is give the blood gas finding which have been given, and explain your management plan. And again, same thing. Answer any question if the junior has. This is the ABG. It was given the data which is given to you. This is a 3 weeks old baby with the view came to ED with vomiting, and the pH is 7.5, PaCO2 of 50, PCO2 of that is PO2 of this is PO2 of 85, and sorry, it was written displayed by PCO2. It is PO2 of 85, and then SCO3 of 35, potassium of 3, sodium of 135, lactate of 2, base excess of 4. And this is again your scoring marks for your skills which you have to perform while going inside. So again, you have got the ABC. Don't get panic even if you don't know the diagnosis. Just stick to your general approach. And then once you complete the general approach and the clinical management, then you come to the diagnosis of the ABC and then the specific management. Same the approach which I have told for the ECG. Again, we'll see how to move ahead. Now again, the general approach is the same in all teaching stations of the either it is ABG, ECG or chest X-ray. You follow the same protocol, same algorithm. Then you come to the algorithm introduction. It is same as I have told in the ECG. You can tell him, I believe you have something to discuss with me regarding ABG interpretation, and then you ask for the ABG. Probably most of the time you would have not given ABG once you enter the inside the room. But at this station, you tell him you have to something to discuss with you. At this time, you can ask about the if I can see the ABG report. And then if it is most of the time it will be abnormal, then in that case, before setting any learning objectives for your juniors, make sure you talk about the patient safety also and patient compatibility also. Then you tell your junior that I'll set learning objectives for you, and today I'll teach you about the normal and the abnormal values of the ABG. Then you start teaching your junior about the pH. Tell him the pH normal value is 7.35 to 7.45, and any pH less than 7.35 is acidosis, pH more than 7.45 is alkalosis. Then you talk about PaCO2. Tell him the normal value 35 to 45 mFHg. If it is less than 35, it is respiratory alkalosis. If it is more than 45, it is respiratory acidosis. Then you talk about bicarbonate, tell him the normal value that is 24 to 30 mFSG. If it is less than 24, you can tell him it is metabolic acidosis, and it is more than 30, it is metabolic alkalosis. And then PaCO2 of normal 80 to 100 mFSG. If it is less than 80, it is hypoxia. If it is less than 50, it is respiratory failure. And then talk about electrolyte sodium and the potassium value, that is 135 to 145. Sodium and potassium is 3.5 to 5.1. Accordingly, you can tell it is hypokalemia, hyperkalemia, or hypo or hyper. Either of the thing can be there in the ABG. And then talk about base axis, telling the normal value is -2 to +2. Anything less than -2 is metabolic acidosis. More than +2 is metabolic alkalosis. Then you talk about the lactate. The normal lactate level is normally 2, less than 2, not 2, less than 2. And then talk about compensation. This is much more important of the aspect of your ABG. If you talk about compensation, you get good marks. Like kind of 9 or 10 you can get if you complete everything and talk about compensation, you get good marks. And finally, talk about the management plan. So what do you need to have to see in your compensation in your ABC? You have to tell to look out for pH, PCO2, and bicarbonate. You see if all the three components are in the acidotic part, then you can tell it is a mixed acidosis, or all the three component in the alcoholic part, you can tell it is a mixed alkalosis. And then you have to compare about two parts more, PCO2 and bicarbonate. If both are in moving trend or both are in reducing trend, that is partial compensation. Okay, I repeat, if both are in the moving trend, positive, or both are in reducing trend, that is partial compensation. If any one of them is normal, then that is uncompensation. And this you have to clear very nicely or the C in the APG. And then you have to tell about the diagnosis and the management plan of the patient. Final, after ABG diagnosis. Again, I have, as I told for the ECG, you have specific points for ABG also. All ABG stations you can tell, keep the patient in observation or recess. Most of the time, you have to keep the patient in your recess, and then connect to the cardiac monitors because the patient is sick, and then examination findings of the patient. And then you talk about blood tests if required, and talk about oxygen therapy, fluid therapy if the patient is requiring, and call specialty, whichever the specialty you think it is medicine, pulmo, or pediatric, whatever case you, depending on the ABG scenario, you call the specialty. And then specific management, as I have told for ECG, depends on the ABG diagnosis. Now we'll come to the ABG of this patient to talk about specific management. So they are told it's 3-week baby. So 3-week baby came to the ED with vomiting. Now, if the baby is vomiting since birth, then the most likely diagnosis is HPS, irrespective of until unless anything proven, it is HPS always. But if the baby started vomiting after 3 weeks, after few days of birth, then it could be either acute gastroenteritis, that could be septic component also. But seeing at the ABC level, you can see lactate is 2, so less likely it is sepsis. But still, you can talk about ED management, like baby has to be kept in the recess way or observation, and you start oxygen therapy or fluid therapy for the baby, and you do septic screen for the baby, and you try to get an ultrasound to rule out any congenital anomaly, and you try to call, not try, you have to definitely call the pediatric on-call doctor. And the specific diagnosis with this ABG was metabolic alkalosis with partial compensation in respiratory acidosis. This is how you have to go towards the ABG station also. And same thing, recap, you check under stability, check or ask his all questions, whatever questions he have, you have to clear all his questions. As I have told, in all set OSCE stations, they will have definitely fixed questions. So you have to always ask if you have any doubt, any questions, and you have to clear all his questions. Once he is satisfied, then you think you are towards a good scoring station. And then you tell him, I'll give you the website and the videos to learn more, and you will come back to me anywhere. Again, stick to the time always. Try to finish all these OSCE stations out of this 6 minutes, 6 minutes, and try to keep 2 minutes, at least 2 minutes for the clinical reasoning. This includes both clinical reasoning, matlab discussion of the management of the patient specific, and also about questionnaire, whatever the questions he have. So try to stick to your time also in all cases. Now, third was the chest X-ray interpretation. So this again, I have taken from the ATLS protocol. and which you, this is the learning objective which you will set for in the chest X-ray station. But still the introduction part and everything part will be the same in the both, as I have told in the ECG and APG. But in case you can tell your junior this, I'll set the learning objectives for you for chest X-ray interpretation. You can tell him the doctor ABCD format for his teaching the station. You can tell him these for the details of the patient, or in case of his look, check the X-ray film is rotation, and you can see the inspiration, how many ribs we can see anteriorly, and then we can see whether exposure is overexposed or underexposed. You have to comment on that. And then soft tissue, you have to comment to look for any surgical emphysema or any subcutaneous emphysema, surgical emphysema. You can see, and you can look for the bones for any fracture or deformity. And then you have to, A stands for AV and the mediastinum, to look at the trachea whether it is central or deviated, and whether you have to see mediastinum is not widened. And then you have to comment on the lung fields and circulation. You have to look for the both the borders of the heart and the right and the left borders of the heart. And then you have to comment whether the patient is having cardiomegaly or not. And then to compare both the domes of the diaphragm to look for any deformity if it is seen. And then you have to comment on extra whatever you can see in the X-ray, whether it is tube, chest leads, ICD, or signs of trauma. You have to comment on that. So this is the learning objectives for in case of chest X-ray. So on any of the three stations, it's easy. Stick to your general approach, and then define your learning objectives. Practice among yourself the learning objectives, and then you can have good scoring marks in this all these teaching stations of the X-ray, ABG, and X-ray. It's easy. And I always tell, whenever you go home, practice. Whenever you, even if you're on duty, practice among yourself. Practice with the junior. Practice with the senior. With your colleagues. You can practice any stations, and that will help you to score good marks in your OSCE station. So best of luck. We'll meet again with one of your new station teaching stations. And till then, practice, practice, and practice. Best of luck. Thank you.